Actually, our practice, because probably of the area that we practice in, is more probably of the slightly more affluent class of people.
Okay.
Because this area, most people living here are of the sort of more of the affluent class.
Correct.
The incidence of diabetes is higher in the affluent class.
Okay.
We get proportionately quite a large number of people who are diabetic. Firstly, because my father has been treating diabetic patients for probably more than 30 to 35 years now.
Okay.
So he's got a large collection of patients, and then those diabetics refer other diabetics to us. But one interesting thing we've seen, and probably what my father has seen, is that though the number of people who are suffering from diabetes has increased, the incidence of diabetic retinopathy and complications of diabetes seems to be reducing. Number of people who suffer from diabetes has increased over the last probably 10 to 15 years. The number of patients who actually develop diabetic retinopathy, especially advanced diabetic retinopathy, what they call as proliferative diabetic retinopathy, the incidence has significantly reduced over the last probably 10-12 years. And probably I would attribute this to the much greater awareness among patients, at least among the educated class, the importance of proper control of blood sugar. 10-15 years back, the awareness of the importance of controlling blood sugar right from the beginning. But the awareness, even among the affluent class, or among the educated class, if you wanted to put it, the awareness that diabetes has to be controlled very well from day one, from the day that you are diagnosed. You can't develop the complications of diabetes and then decide to control your sugar.
True. Very true.
Because once the complications have set in, they are not reversible. Also, that a lot of damage has already been done.
Very true.
So, this awareness over the last probably 10-12 years has really helped in significantly lowering the complications of diabetes, at least of diabetic retinopathy.
Okay. Now tell us, doctor, how many people in terms of percentage, in terms of eye problems, how many actually turn out to be diabetic?
Out here overall, probably in our practice, you can say maybe about 10% of all the patients, 1 out of 10 could be having a history of diabetes.
And do you see any trend in terms of male, female, elderly, teenagers, that kind of trend? Can you tell us about that?
The incidence is definitely seems to be higher in men. As compared to females, probably because diabetes is partially a lifestyle disorder. Certain lifestyle habits like smoking, obesity, sedentary lifestyle, probably oily food are known to increase the risk of developing diabetes. So since things like smoking, and things are more of a male habit. Probably that could be one of the contributing factors to
There are also diabetologists who would say that if your blood sugar is controlled and your blood pressure is controlled, then organ failure may not be, you may not be affected by organ failure at all. Would you also agree to that?
Absolutely. Control of blood pressure in a diabetic is as important as control of blood sugar, because when you have uncontrolled hypertension, you get narrowing of the blood vessels.
And hemorrhages.
And hemorrhages, and that contributes to slowing of the blood circulation, and that is what is actually causing the complications of diabetes. I mean, the slowing down of the capillaries in the body is what actually is the cause of the complications of diabetes.
True. Doctor, we get a lot of emails from patients with disorders. Now they ask, for instance, one email was about, how do you prevent further damage if your eyes are already damaged because of diabetes? How do you prevent further damage? You have any particular advice for that?
The first thing that you have to do is perfect control of blood sugar and blood pressure. You have to, if you are leading a sedentary lifestyle, you have to start doing some sort of physical activity every single day. Walking, exercise, yoga, aerobics, whatever you want, but some sort of physical activity to burn the sugar in your body. And very important, you have to completely, if you are a smoker, completely stop smoking. And you have to completely avoid fried, processed and preserved food. Fried means oily food. Processed means that canned food, packaged food, fast food, junk food, etc. And preserved means what you keep in the fridge and eat after 1 or 2 days. And the regular Indian diet, roti, vegetables, dal, pulses, cereals, salads, curds, milk, I think is the best diet for a diabetic. The regular Indian diet.
Doctor, there is also notes by diabetics that diabetes can actually become reversible in terms of vision getting better because of better control on sugar as well as your blood pressure. Do you also notice that there is reversibility of diabetic symptoms?
Yeah, in the very early stages of diabetic retinopathy, we have noticed that patients who have really very seriously controlled their blood sugar, those few hemorrhages that start actually get absorbed. So the diabetic retinopathy actually gets reversed. But once it progresses to the advanced stage, then it may not get reversed, but at least it will stop progressing if you control the sugar properly.
Do you also see that there is some kind of fear among diabetics to go to an ophthalmologist or get treated for eyes? Because eyes are so sensitive, and when you talk about laser treatment and all that, there is some kind of inhibition among patients. Do you see that in the first place? And if at all there is inhibition, how do you counsel them?
Yeah, actually, if the person has very early changes of diabetic retinopathy, you can just observe them. So if the patient has been coming to you regularly, and he's already aware that he has got mild diabetic retinopathy, then in case that condition progresses, the patient is mentally aware that he is suffering from a problem for a certain time. The patient can actually notice the slight deterioration of his vision. So the thing is, they are usually mentally prepared to get some sort of treatment done to arrest that decrease in their vision. If the patient is coming for the first time with advanced diabetic retinopathy, normally they already have some kind of symptoms. The best way to convince a patient is to take a fundus photograph. So that we do that with a special camera called as a fundus camera. And then on that computer monitor, we actually show them the picture, we show them the hemorrhages, we show them the leakages, everything, and that works as an excellent tool, because then the patient is actually able to see his own retina, and he's able to understand that he has got blood clots inside, which need to be treated. So I think that fundus photography works very effectively in the ability to convince a patient to undergo some sort of treatment.
What about other complications other than retinopathy? It could be cataract, it could be glaucoma. In those cases, how do you deal with patients?
Cataract actually usually comes at a slightly earlier stage. Most of the educated or the affluent class, I mean, cataract surgery is quite a well-known or a well-established procedure.
Okay.
So usually most patients don't really have apprehension about undergoing cataract surgery because they already know of some friend or family member who has undergone cataract surgery. They know that it just takes a few days to recover, that it's not a very lengthy procedure, it probably takes just about half an hour to do the surgery, and probably 10-15 days the recovery is almost complete. There is no actual special help required. So cataract surgery is quite well known. Most diabetics have what is called as open angle glaucoma, which doesn't really require surgery. It only requires the use of eye drops twice a day. You know, in the eyes you got something called as a trabecular meshwork, which actually drains the fluid out of the eyes. Okay, now when this gets narrowed, that is called as closed angle glaucoma. However, in some cases the trabecular meshwork is still patent, but the rate of outflow is reduced. Okay, so that causes an increase in the eye pressure, and that is what can lead to damage of the optic nerve, which is the main nerve of the eye. So the thing is that to keep this under control, you only need eye drops, and most people are not very apprehensive about using eye drops. Open angle glaucoma usually does not require any sort of surgery, and the patients can be well controlled just by putting eye drops twice a day. That is all that is required. So there, I mean, compliance is not such a big issue.
Okay, doctor, what about symptoms like seeing rainbow colors around the lights? What actually are they when it comes to diabetics having that kind of symptoms?
The most common cause is glaucoma or raised pressure. And here it is important to consult an ophthalmologist as soon as you can, because otherwise if this eye pressure remains persistently high, it can cause irreversible damage to the optic nerve, which is the main nerve of the eye, and eventually that can lead to irreversible blindness. So it is very important to meet your eye doctor and to get the treatment. Usually it is just eye drops, which are to be used once or twice a day.
Doctor, now let me ask you about some very interesting developments which are happening on stem cells. How can stem cells actually help in treatment of eyes for diabetics? Can you tell us about the latest developments in that, and how hopeful are you in stem cells?
Stem cells for treatment of retinal disorders so far is in the very experimental stage. At this point of time, I mean, the main effect of diabetes is on the retina, which is the back surface of the eye. Stem cell therapy for the retina is still in its fairly early stages. Infancy, it's really not come down to clinical medicine on a very regular basis. But if you can have some sort of stem cell therapy in the future for the retina, of course it would help a lot of patients with diabetic retinopathy. I think, it is, if you can have a very effective program of training optometrists,
the paramedics.
The paramedics, on at least how to screen patients with diabetic retinopathy. Because you find that a lot of patients go to optical shops and just get their eyesight checked, then their spectacle number checked, but they don't really get a complete eye checkup done. They think that that is adequate. If you can teach the optometrists who are working in those optical outlets just to do a screening examination of, just ask the patient if he is a diabetic and just do a screening examination with an ophthalmoscope. In the
and it could be about your pressure on the eye or what?
No. With an ophthalmoscope, they just need to see the retina. You can do it even with an undilated pupil, and you will be able to pick up quite a few patients with diabetic retinopathy. Just screen them. If you find any sort of changes, you can just recommend that they go and meet an eye doctor. That way, a lot more patients can be screened and counseled. Also, it is also very important if physicians, general physicians and diabetologists or internists can be trained in doing fundoscopy just as a screening test. Because at the level of the general practitioner, if in their own clinics, if they can just with an ophthalmoscope just screen all the diabetic patients, then actually a lot more patients can be screened for changes of diabetic retinopathy. And so I think, training general practitioners, internists and optometrists will really actually help in this whole screening process. You can, by doing that, you can bring down the level of blindness caused by diabetic retinopathy, because then this can be filtered down to cover a much larger area of the country.
But doctor, why don't you also include the eye pressure to prevent glaucoma?
Yeah, and also they can check the eye pressure.
Because that's very
nowadays,
simple.
Yeah, very simple, because nowadays you get something called as a non-contact tonometer, which can be operated by any technician. It's just basically, it's very, very simple. Even somebody who's passed 10th or 12th standard, any technician working in an optical outlet, they just have to focus the eye and press the button and you get the eye pressure. It's absolutely non-touch. It is very easy to perform and it is fairly accurate. So the thing is, anybody with changes of diabetes or with a certain higher than normal eye pressure can they can just be asked to meet an eye doctor just to have the eyes further examined.
Thank you so much, sir, for being with us.
Yeah.
Thank you.
Okay. Thank you.